Hi, my name's Trudie Davies and I'm the Chief Operating Officer at Mid Yorkshire Hospitals, and I'm so grateful to be given the opportunity to express my thanks to all of you at work at Mid Yorkshire and explain what I'm thankful for. My list is probably extremely long, and I could always start by saying thank you to all of our teams, all of the staff that work here for everything they've done in the pandemic. I'm grateful for the personal support I've had from my deputies and from the people that work around me. But the thing I'd really like to say thank you for is all of the staff who have continued to improve and deliver excellent services to our patients in really the face of adversity, in the face of some of the worst things that we've had to deal with. I don't know that all of you know how much good work has been going on, how much innovation, how much transformation, how much effort has been made by people to just make things better. So I've got some examples I want to share with you. So I want to share with you the story about the Stroke Hub. Our stroke services are absolutely amazing. We have been working hard collectively to take patients from Barnsley and give them a great service here at Mid Yorkshire. And after that period of transition and service improvement, we have now been recognised as a national exemplar model in our Stroke Hub for the way that we deliver care. And that's not good enough for the Stroke Hub. They are now working on making things even better and using the lean management approach to improve their efficiency even more. So I'm so pleased and proud, and I just want to share that with you. We've been highlighted for good practice in our work to identify and treat people with surgical site infections, particularly in trauma and orthopaedics. Been called out for the way that we've set up infection prevention team working in hubs to look after patients and make sure we learn from these events and that they don't happen again, really improving care right through the middle of all this awful stuff that's been going on. Maternity transformation. There's been so much improvement going on in maternity. Again, it's been called out as a national exemplar site for the way that we are managing and improving maternity services. We've got to thank our midwives for that. Elective transformation work. I can't tell you how many people have been involved in transforming the way that we accept referrals for patients now. So our GPs have been working with our clinical staff and our PMO team and our management teams to work new ways of getting patient referrals straight into the organisation through a route of e-consultation, making sure that they do not experience delays, that we get people treated on the same day in some cases, things that they can manage that they don't have to come to hospital for, avoiding travelling in this pandemic and making things so much better. It's absolutely amazing. I think you should be so proud that we work in an organisation where this is happening. Access times in diagnostics. Obviously during the pandemic, when patients were unable to attend and we were unable to offer some services, we had real worries about diagnostic services because they are such a core fundamental piece of all pathways that we deliver. Yet our teams in endoscopy, radiology and pathology have gone way over and above anything you would expect to recover those access times, putting us one of the top in region in the way that we can access diagnostics for our patients. Absolutely amazing, outstanding work. Let's think about our allied health professionals. Well, they've transformed how they're working, they've changed roles, they're working in different jobs, stopped some outpatients, started some other work, supporting in ICU and ARCU, and our WICU team totally changing the function and service that they provide in order to meet the needs of the patients that we serve. And there are so many, I could go on and on, but we've got our behind the scenes teams, our information services. If you can imagine how much pressure we're under to report everything every day, different situation reports, we're all asking for information on quality, information on access, and they respond in a really timely way, giving us in Wakefield and North Kirklees and Mid Yorkshire a really joined up view of information to help us manage the pandemic. I've got to say thank you to our EPRR team, who have been fantastic, helping us to learn from events, and our infection prevention and control team for everything they've done. And everyone that works at Mid Yorkshire who has contributed to what can only be described as the biggest team event in the history to keep our patients safe. And I'm really grateful, I'm really thankful to work here. Despite everything, I enjoy nearly every day at work. I enjoy meeting people, and the best thing I can do is take this time to say thank you to you all. So thank you very much and Merry Christmas.